Good afternoon. Good afternoon. It's a lot easier to talk without a mask, but we're being safe here at the Press Club, so I want to make sure that you understand we're taking all the precautions. My name is Joe Grace. I'm here to welcome you to the 2020 VHA Innovation Experience. This is an exciting time. We have some incredible speakers here today. We're going to hear from the leadership. We're going to hear from the providers. We're going to hear from veterans. We're going to hear from innovators. We're going to hear from industry. And my privilege is I get to be the captain. Now, as a Naval Academy graduate and a veteran myself, I'm a nuke submariner by training. We try to keep things on the down low, but today we're going to bring out all that innovation, all that experience. We're going to bust a little bit on our Army friends. We've got some Air Force speakers, so we'll make sure everybody's comfortable. But more than anything, we're going to talk about the veteran, and we're going to talk about what we do to make their lives better. How do we help the mission? How do we help what they're trying to achieve, and how do we fill their experience with a better way of life? It's going to be exciting. We have with us the Executive Director of the VHA Innovation Experience, Dr. Ryan Vega. Now, I'm from New Orleans. He's from New Orleans. Paul Tibbets is from New Orleans. If you ask where we went to school, we'll tell you our high school. They all went to Jesuit. So we've got a Jesuit contingent here bringing you LSU Tigers and a bunch of other technologies. Now, Dr. Vega has been some of the vibrant experience and excitement that's coming out of the VHA, but the Veterans Health Experience, this whole innovation, this is a way of life for the VA. It's something that they're known for across the country. And we're going to have some really amazing speakers today. We're going to talk about some innovations that will truly make a difference for our veterans, their service members, and their families and caretakers. We hope that you'll join us for this experience, and we're looking forward to that moment. I'd like to turn it over to Dr. Vega, who's going to give you a quick introduction on our experience for today.
This is about telling our story. And I think it's sort of eye-opening when you hear some of the comments from Innovation Experience, is people to sort of say, VA's really doing that? And what better way than to show them?
Coming here reminds me of who my family is, renews me, reinvigorates me, and gives me that energy I need to go back and fight the hard fight of innovation.
It's just really thought-provoking. And there's just a lot of things I think we're learning that we can help, diffuse to our own networks.
The Innovation Experience is a gathering of incredibly brilliant, incredibly resilient, and incredibly passionate VA employees, along with their academic and industry partners that are designing solutions in real time to change and save veterans' lives.
Greetings, I'm Ryan Vega, and on behalf of the entire VHA Innovation team, welcome to the 2020 Innovation Experience. I'm standing here in the ballroom of the National Press Club. Now, ordinarily, this room would be filled with people, the energy around the event palpable. But these are not ordinary times, and yet, VA is not an ordinary place to work. Our workforce is not an ordinary workforce, and our mission is no ordinary mission. This year has been filled with so many challenges we have all shared. But events like this remind us what we can accomplish when we share a common goal and unite to deliver more together. The innovative spirit of this organization helped advance and design new ways to deliver care and service during this ongoing pandemic. From telehealth to rideshare programs to 3D printing, we are redefining what it means to be an innovative organization. And that spirit is driven by all those who work in VA, by those who partner with VA, and by those who lead VA. We have been so fortunate to have leaders who do not just support an innovative culture, they embrace it. In a little while, you will hear from one such leader, Dr. Steve Lieberman, the Acting Undersecretary for Health, on many of the incredible innovative efforts going on in VA. But first, it is my distinct honor to introduce another senior leader to kick off the 2020 VHA Innovation Experience. Someone who exemplifies the role of servant leadership, a veteran herself, our Acting Deputy Secretary, Ms. Pam Powers.
Ryan, it's really good to see you again, and thank you for that kind introduction. Welcome, everyone. This is really exciting. It's hard to believe that it was just 2 years ago that I was standing at this very podium to launch the 2018 Innovation Experience Conference. I was about 45 days into serving as VA Chief of Staff, and if you did see that, you might have realized I was a little nervous. But I was really excited to be part of this incredible organization. Back then, the word virtual wasn't used very much, and now it's used virtually all the time. But change is the nature of things. I remember when the planes hit the World Trade Centers and the Pentagon, the refrain we heard over and over is everything's changed, and it had. And this year, COVID-19 also forced change upon us. Some of the most fundamental aspects of our world, national and community cultures, have shifted dramatically, more than anyone could have ever imagined. So here we are, again, in a world changing before our eyes, meeting virtually to talk about change. But we're not just here to talk about how we've responded to change, but we must be more forward-looking than that. We're here to talk about how we can initiate change, how we can work together at VA to deliver more for veterans, and by extension to all Americans. That's what the VHA Innovation Ecosystem is, and this conference is all about. And this year's theme, Delivering More Together, isn't a platitude. It's what we've been doing, and it's what we'll continue to do to serve those who have served us. Innovation at Veterans Affairs isn't anything new. The VHA healthcare system has steadily evolved as a national laboratory for over a century. Again and again, I'm amazed at something new I hear about from our researchers or by all that the innovation ecosystem is doing by lowering costs, improving health outcomes, and enhancing the care veterans receive. There's no story that needs to be told more in this nation of the VA innovation and what it means to veterans and America. And your story is being told in no small way by all the accolades VHA innovators are receiving for their work. This year's conference comes just weeks after VA employees won Gears of Government President's Awards for innovations that save veterans' lives by deprescribing overprescribed medications or reducing opioid overdose death and preventing hospital-acquired pneumonia. And this month, VA Connected Care and 3D printing leaders were nationally recognized with the coveted Samuel J. Heyman Service to America Awards, otherwise known as the Sammys. VA has a long history of those game-changing accomplishments, and there are more to come. And frankly, there aren't enough awards to go around, but we cannot miss this point. All the work and the intellectual and capital investments we make in innovation ecosystem aren't about the complexity of the network or national recognition. They're about how good work helps each individual veteran, and all your good work helps. It's about delivering more together for veterans. And there are many examples. It's veteran-focused design, custom orthotics for a veteran just learning to walk after his injury, or individualized prosthetics for a veteran who lost a limb. I saw innovation firsthand when I visited Seattle just a few short weeks ago. It's thermal imaging mats wired to telehealth platforms, measuring the temperature of a veteran's foot at home, preventing amputation so she never needs custom prosthetics. It's telewound care, saving a rural veteran the risk of travel without compromising his high-quality health care. It's telerehabilitation that checks and adjusts a veteran's wheelchair function, or telelactation support for a veteran who's a new mother. It's biomarker testing that provides early detection of subtle psychological dysfunction in a veteran with post-traumatic stress disorder. Or it's virtual reality therapy for veterans with mental health conditions. And these are just a few of the ways that VHA Innovation Ecosystem and all of you are imagining the future. But in the final analysis, the measure of the success resides with the veterans we serve. And if their trust is a fair measure of success, you're on the right track. And this year, when COVID was at its worst, the monthly average of veteran trust in VA outpatient health care topped 90%. And much of that was telecare. And telehealth has become a lifeline for veterans in this changing world that we live in. And it's no small part to the kind of innovation that your work provides, not just in developing innovative solutions, but in building the trust and restoring hope in our veterans, with our veterans. And it's exciting, it's promising, but here's what's more exciting. These next 3 days are about accelerating even more innovation, outcomes for veterans that we and the nation can be celebrating in months and years to come. Imagining the unimaginable, anticipating change, adapting to and taking full advantage of the immense opportunities change offers us. It's exactly what this innovation ecosystem is all about, and exactly what this conference is all about. So to Dr. Clancy and Dr. Vega, and to everyone partnered with, associated with, supporting, and participating in this VHA innovation experience, we all owe you a virtual round of applause and a standing ovation. But we owe you so much more. So on behalf of Secretary Wilkie and all the veterans and families your work touches and whose lives you change for the better, congratulations and thank you. It is my incredible honor and really great pleasure to help launch this year's virtual conference. Enjoy these next few days, learn from each other, and continue to innovate. Thank you.
Welcome back. It's good to be here. I decided to wear my Navy mask this time to bring a little more spirit to the game. I'm here with Dr. Vega. So Ryan, this is incredible, and you're an internal medicine doc. What have you seen, and I know in your time at VCU and people say that your superpower is that you're innovative, and that's one of the great things you do. What energy are you bringing to this, and what do you think about the way the VA is approaching this?
Yeah, well, as an internal medicine doc, if you were to ask surgeons, they would say that my superpower is certainly not brevity. But I think we're changing that. I think we're seeing innovation scale at a pace traditionally not accepted or commonly thought about. We're seeing solutions spread from medical center to medical center, not in decades, but literally in weeks and months. And so when you were the CIO at Navy, what are some of the things that you saw about innovation that really helped catalyze new efforts and advances in care?
Well, I think one of the reasons that we've seen that is when I was back with Navy medicine, we were taking a lot of casualties during the war. And the innovation that came out in prosthetics, the innovation that came out in traumatic brain injury, the things that we worked on and saw that the medics and combat corpsmen in the field were bringing back ideas of innovation that we had never seen before. As that transferred over to the VA and the VHA, we've seen monumental changes in innovation, a lot of that due to injuries and catastrophic casualties that we've had. But it's brought about a whole new sense of innovation. I was really excited to hear Ms. Powers talk about some of those innovations with our foot temperature readings and some of the other things that we're doing for home health care. Where do you see this going?
Yeah, I think you're seeing the new era, the new dawn of what healthcare is going to look like, what we want it to look like. We were heading in this direction already, but COVID really accelerated this. And I think what's important is that while it's easy to celebrate the past and say we did a lot of great things, most people want to know, what are you doing for me tomorrow?
Right.
And I think what you're hearing, what you're seeing for is really VA being a forward-leaning, a progressive organization, and not only the adoption of digital health, but pioneering what this work's going to look like for all Americans.
Well, I hope what you can see if you're watching this out of your home or out of your living room, your basement, wherever you may be, if you're on your boat and you don't want to tell anybody, innovation is the spirit of the VA right now, and the VHA is doing some incredible things. I think we're going to hear from Dr. Lieberman right now, and he's going to bring another perspective of this. Ryan, you might want to do an introduction for us.
That's right. You're going to hear from Dr. Lieberman on some of the great things that we've been accomplishing over the past year, whether it was responding to the pandemic or even research advances to help not just veterans, but Americans writ large.
Dr. Lieberman, over to you, sir.
Good afternoon. I am Steve Lieberman, your Acting Deputy Undersecretary for Health, and I also want to welcome you to the 2020 virtual conference on the innovation experience in VA. This is going to be an exciting program that you will be experiencing. So innovation is at the core of what we are all about in VA. It's been that way for a long time now. It just takes one employee, one frontline employee, to come up with an idea. Ms. Pamela Bellino at the VA in Boston saw the benefit of having reversing agents on our code carts when somebody had an arrest, a breathing arrest from using opioids. And she came up with the idea, what if we also put it on our automated external defibrillator carts? Wouldn't that be a good idea? And so she did, and it started to result in saving lives at Boston. And then slowly but surely through the Innovation Network, this spread throughout VA and now is a gold standard in this country and has spread outside of VA. Dr. Shannon Monroe, a nurse, came up with the idea that we really need to look at the benefit of oral hygiene, the simple act of brushing your teeth when you're in the hospital, and was able to demonstrate the benefits of doing this to reduce the incidence of hospital-acquired pneumonia. This led to saving much complications for veterans and saving lives, and this spread throughout our healthcare organization and led to spreading outside of our organization. These are just two examples of our wonderful employees in our organization who have made a difference for veterans healthcare and healthcare in this country. This is a great example of how VA is a learning organization. We learn from both good things and also when things don't go the way we intend, and we spread it. That's the way this innovation network works, and that's the way we carry out our activities in VA. Similarly, as you know, VA is invested fully in becoming a high reliability organization. And this is also important, where staff feel comfortable to come forward and say, I see something that I don't like, and so I'm going to stop the line. I'm going to say, time out, before a veteran is harmed, and come up with an innovative way to improve things for veterans care. We have an organization that has a just culture, where our staff feel comfortable also coming forward and coming up with ideas, creative ideas, making a difference in veterans' lives. All of this has been so important in the last year. 2020, as you know, has been the most challenging year in healthcare in about 100 years. I know it's been the most challenging year for me and my profession. And VA has been a leader in this country in the approach. As most of you know, when we first heard about the first cases in Wuhan, China, we started working on what our plan was going to be. We started to think creatively, how were we going to deal with this should it reach our shores? And sure enough, it did reach our shores. And we started thinking, what's going to be the best way to protect our veterans and staff? And so we began screening at all of our entrances before anybody else was doing it in healthcare. And similarly, we started restricting visitation to our community living centers and our spinal cord injury units, and anywhere where there was considered to be high risk for veterans. We started to pivot to increasing our options for in-person appointments. And so we started to grow our telephone appointments. We grew it by 73%. We started to increase communication with veterans through secure email messaging, growing that by 4 million this year. And that's about an increase of about 33%. And then we also, as you know, grew our telehealth, and in particular our anywhere to anywhere telehealth. So most commonly, if the veteran is now receiving many appointments at home, and we increased that by over 1,400% in the last year. And that's just wonderful. We also have reinvented the way we hire people. And we used to take months to hire people, as you know. And at most of our VAs, we were able to, through some ingenuity, through some innovation, we're able to get the speed to hiring down to 7 days, and in some places, in some positions, down to 3 days, 3 days. And so we have hired well in excess of over 50,000 new staff since the beginning of COVID was here in March. And similarly, as a result of that, we now have more staff, and we've been able to open more beds to take care of veterans as well as civilians as a part of our fourth mission. We've been able to creatively open up units in post-operative recovery areas, gastrointestinal endoscopy suites, and doing whatever is needed. We never, despite how busy we have gotten with COVID, we have never had to turn a veteran away from one of our VAs that takes care of acute care patients because we didn't have enough beds. We are now, have shown the country that VA is a leader, that we can back up the healthcare system in this country in so many ways by sending staff out to private healthcare systems to help them, by providing them with supplies, by helping Indian country with what is needed, and again, accepting both veterans and civilians into our healthcare systems, helping our nursing homes across the country when they have been challenged, using our creative ways on how to best approach this and evolving and changing as we learn and go through this. So this has been wonderful. We also certainly, under the leadership of Dr. Rachel Ramoni, are a leader in research in this country, and this has been particularly important during COVID. We are out there as participating in the vaccine trials, in all the medication trials, and I really thank Dr. Ramoni and her team for focusing research on what is most important to veterans and really making a difference every day. And then I want to thank Deborah Shear and her team for working with us on partnerships, which are so, so important. One of the speakers during this conference will be Dean Kamen, who's been a true friend and partner to VA during COVID. Through his innovation talents and working with us, we've been able to think of creative ways to procure additional personal protective equipment that matters to us in VA, that we need to ensure that our staff remain safe during this pandemic. And he's also been working with us, as well as the Manchester VA, to look at how we can align and to improve innovation in medical care and technology in VA. And so there'll be more exciting things to come out about this, and hopefully you'll hear more about this when he presents later in this conference. Another area where the importance of VA's partnership with the public world is our accessing telehealth through local area stations, which is also more commonly known as our ATLAS program. And this is where we partnered with organizations including the Veterans of Foreign Wars, American Legions, Philips, and Walmart. And what we did is we developed, through getting feedback with veterans, we set up rooms in different locations where veterans can be safe and securely talk to their healthcare providers in primary care, mental health, social work, and nutrition, and not have to pay for it. And this has been really important in rural parts of the country. We initially put a pause on this because of COVID, but now it's coming back bigger and better. And this is going to be a way for them to get care in rural parts of the country, and this is so important. And so we thank all of our partners in this really important program. Innovation has been equally important throughout the COVID pandemic in our 3D printing. We thank Dr. Beth Ripley as well as Dr. Ryan Vega for their innovation in this area. And we had been working so hard in this area long before COVID, but this really during the COVID era truly showed what we are made of in how agile we could be with 3D printing, how we could quickly switch to focus our efforts on 3D printing of our personal protective equipment, such as masks, testing materials, such as swabs. And then we truly have had our staff in the field come forward and tell us about challenges that they faced and how they dealt with that. So, for example, at Richmond, Virginia, the doctors there saw a risk of, during the intubations of patients, because getting close to the patients, concern about potential transmission of COVID to the staff. And what they developed was a clear box to go around the upper part of the veteran that the anesthesiologist could safely intubate the patient with. And then at the Puget Sound VA, our eye specialists were able to continue their examinations, which were viewed as high risk, by developing shields so they could get close to the patient with their sophisticated equipment and be able to examine that veteran's eyes. That was something that our staff came up with the need and then came up with a solution. And then finally, at the Charleston VA, they were hearing from veterans that when they were putting on their masks to protect themselves from COVID-19, that those with hearing aids were damaging their hearing aids. And so this facility came up with a solution of how to put a cover on the hearing aids so they would still work, but they wouldn't get damaged when they were wearing face masks. These are all exciting innovations that have gone on, and I expect they will get shared around the country in the coming months so that all of our veterans and all of our facilities can benefit from these wonderful innovations. So it's really been a pleasure for me to highlight for you some of these high priorities that we've been working on in VA in the last year. Again, these are challenging times. I can't thank all of you enough for your contributions to the innovation in our organization and for what you've been doing every day in the fight against this pandemic. I also want to thank Dr. Carolyn Clancy, who will be speaking to you later in this conference. Dr. Clancy, as you know, is our dean, who's in charge of our discovery, education, and affiliate networks. She has just been so instrumental as we have moved forward in all of these endeavors. And then finally, I want to show my appreciation and gratitude to Dr. Ryan Vega and him and his team for making sure that this innovation network effort just continues to grow and be successful. And thank him for keeping this important conference going despite the pandemic. So thank you all. Keep doing the great things you are doing and really enjoy and learn from this conference.
So Ryan, what's up? You don't have a New Orleans mask? You're not supporting our team and the Saints?
Not today. I'm taking a break today, and I think, I'm still a little bit nervous about how this season's going to unfold. We've got a lot of injuries and a lot of banged up players, but I'm pretty confident that we'll turn it around.
Well, I got to tell you, when we talk about the Saints or we talk about the Saints in the VA, these are the folks that are doing innovation. Public-private partnerships make up a lot of what we're trying to do, whether it's a CRADA that you work together, whether it's the VA people bringing it forward, whether it's an industry partner bringing this in. That really makes the difference.
I think so, Joe. I think the whole theme of this year is delivering more together. I think really embracing the idea of how we come together, not just as a VA community, but as a community at whole, to really advance and scale some of these incredible innovation efforts. And the two folks coming up next, these are individuals that I think define what innovation really is all about.
We have Chris Meeks, who's going to be talking to us about some of his great stuff that he's been doing. And then we're also going to have Dean Kamen, who's going to be talking to us from DECA. And Chris is not going to be with us in the room here. He's going to be coming in via video. And Dean is here with us. But that excitement of industry has to bring that in. And just like you have some kind of infomercial late at night wait, there's more. This is going to be exciting.
That's right. And I think what you're going to see and hear, is particularly when we get to the fireside chat, when you hear from Dr. Ken Kaiser, the former Undersecretary, as well as Mr. Dean Kamen, you're really going to hear this idea that innovation is not just about the shiny object, right? It's about how we transform the experience, how we really recreate the meaning of value. So I'm really excited to dive in.
I am too, and we've got a special announcement that they're going to be bringing, but one of the things that you haven't seen at home is that Dean's been riding around in his iBot, which is, again, an innovative wheelchair that puts the patient, puts the member, the veteran, up at eye level with those that they're talking to. And it's always been a little bit of a difficulty with someone in a wheelchair. They feel like they were talked down to. And this exciting innovation brings them up to eye level. And we've watched him kind of moving that machine around the office and around the studio here. It's really been exciting. So with that, let's go over to Chris, who's coming to us via live video.
Thank you for the introduction, and apologies for not being able to be there in person today. Amore patria ducit. That's Latin for love of country leads. That's why we're all here today, and that's why we all do what we do. Good afternoon, everyone. I'm Chris Meek, the co-founder and chairman of SoldierStrong. I'd like to thank you for attending this important event. I have the great pleasure of introducing you to one of America's great innovators today. From drug infusion pumps for insulin, to the Segway, to the iBot, to the Luke Arm, and many, many more, Dean Kamen is one of America's great minds. But before we talk about the technical advancements in the science, I want to tell you a story. For me, it's the story of why all of this is so important in the first place. It's the story of why your topic, embracing disruptive innovation in healthcare, is more than a nice title. It's a critical mission for our nation right now. More than 19 years have passed since September 11th, 2001. Yet the memories of that day and the care of those who have borne the battle to keep us safe since is an ever-present driver of our work. I was running floor treating operations for Goldman Sachs that morning at Ground Zero in New York City. The images of that day are seared in my mind forever. I saw 2,977 Americans murdered that day. I remember seeing people jumping from 104 stories because that was their best option. I can tell you the color of at least 3 women's dresses. I'll never forget the one who was holding her dress down as she jumped so no one saw her undergarments, saving her dignity until the very end. I didn't realize for years how affected I'd been by the experience of that day. What I knew that day is how much awe I had for the first responders and for those who have served in the years since. For me and a handful of friends and colleagues, forming SoldierStrong was our way to give back to those who served. We couldn't have known when we started how things would work out, certainly wouldn't have guessed it. I can tell all of you the lessons we've learned. Perhaps the biggest is the need for innovation in healthcare. Not just marginal evolutionary innovation, but truly revolutionary innovation that solves the hardest problems, treats the toughest conditions, and restores our nation's veterans to fully healthy lives. Our mission started in 2009 with a request from a Marine asking for tube socks and baby wipes to make things more comfortable at forward operating bases in Afghanistan. Since then, we have shipped over 75,000 pounds of supplies to 73 units in Iraq and Afghanistan. This mission to help our service members grew and evolved into our current mission to help America's military veterans take their next steps forward. As the wars in the Middle East wound down, our veterans face challenges at home that must be addressed. SoldierStrong addresses these challenges in a variety of ways. We have donated more than $3.8 million in state-of-the-art medical devices to individual veterans and VA medical centers across the country. These devices include hyper-advanced prosthetics, specialized rehabilitation, and our signature device, the Soldier Suit. We have donated 24 Soldier Suits to date, and Dr. Vega, you'll be happy to hear our 25th will be next week in New Orleans, VA. Each Soldier Suit allows paralyzed veterans to do the once impossible, to stand and walk again. Our mission with this program is to address the visible wounds of war with revolutionary medical equipment that literally helps veterans take their next steps forward. One of our Soldier Suit donations back in 2016 went to the Denver VA Hospital. In addition to serving the spinal cord injured veterans of the Denver area, the VA used the suit in a mental health study. The results of that study were remarkable. It turns out that standing eye level with the world again transforms a paralyzed veteran's brain health in addition to the physical benefits. As one veteran said, seeing people in the eye instead of the belly button is awesome. The Denver study found these brain health benefits extend all the way to reduction in paralyzed veterans considering or attempting suicide. These powerful results planted the seed for us at SoldierStrong that our model of providing revolutionary technology to our veterans could perhaps be applied to the challenges of post-traumatic stress and veteran suicide. The evolution of Soldier Strong, from providing care packages and helping paralyzed veterans stand and walk, continued in some new and exciting ways for our 10th anniversary last year. We evolved again to help address the invisible wounds of war. They're so common, yet so difficult to address, with a new program called Strong Mind. The mission of Strong Mind is to reduce the number of veteran suicides that plague the country. More Vietnam-era veterans were lost to suicide in the years following the war or were lost in combat. And the post-9/11 generation is on a similar trajectory unless something's done to change that. Research done for the Department of Defense found the single biggest factor in suicide ideation or attempts by veterans is untreated post-traumatic stress. We've partnered with leading medical researchers in 4 major universities to provide revolutionary virtual reality-based PTS treatment that has shown exceptional success in clinical trials. Soldier Strong is working with the VA's innovation ecosystem to deploy and improve this cutting-edge therapy so it can reach every veteran who needs it. Last fall, we donated the first of these protocols to the Syracuse VA. They have since donated to a total of 14 VA hospitals. Our goal is to have 20 delivered by the end of the year. Now I'd like to show you some of the capabilities that already exist and provide a small window into the ongoing research in this exciting new field with a short video. Can we play the video, please?
A year. To put that in perspective, we've lost more Vietnam veterans to suicide than all the names listed on the Vietnam Wall. The most common underlying factor is untreated post-traumatic stress. And now the post-9/11 generation is on the same trajectory.
We are in the middle of a long overdue national conversation about veteran suicide. Now, virtual reality isn't a technology that VA developed, but we partnered with the University of Southern California, a nonprofit called Soldier Strong, and applied VR to help veterans with PTSD and pain management. Virtual reality allows them to relive, reimagine those traumatic events in a controlled setting under the care of clinicians. We found that giving veterans a chance to process those emotions can be an effective treatment for PTSD.
I think it's hard for people to imagine the enormity of the challenges that people face when they come back from war and adjust to civilian life. We can activate emotions in a very deep way in VR, helping a patient go back and confront and process very difficult emotional memories.
You experience something that's horrific that your body doesn't know how to comprehend. And when you don't address it, it just manifests in this horrible thing, and you end up locked in your room, hating the world, thinking everybody's coming after you. And I didn't want to be that person. Talk therapy after talk therapy, it wasn't working. And it was like, now what? What am I going to do? Virtuality was a godsend.
The partnership between USC, Soldier Strong, and the VA's innovation ecosystem has been essential for breaking down barriers to care and making this treatment more accessible to those veterans who can really benefit from it.
Soldier Strong was founded by a 9/11 survivor who was at ground zero during the attacks. Chris Meek's experiences that day inspired a desire to give back to the men and women who serve. Soldier Strong's mission is to help our nation's heroes take their next steps forward. Their signature work focuses on transforming lives for seriously injured veterans by pairing them with revolutionary medical devices. The Soldier Suit allows paralyzed veterans to get out of a wheelchair and walk again. The Luke arm replaces the old prosthetic arm with one that provides a full range of motion. And now, Strong Mind VR treatment accelerates the treatment of PTS while reducing the stigma of seeking treatment, opening the possibility for life-saving intervention for our heroes. We owe an enormous debt to our nation's veterans. Soldier Strong's commitment to delivering revolutionary advancements to care for our service members is a small but significant part of honoring our shared obligation to those who have secured our freedom. As long as lingering wounds of war affect our veterans, Soldier Strong will be there to partner with the VA's innovation ecosystem.
Our story is one of continually embracing disruptive change in healthcare. You saw in our video, and more importantly, you can see it in the lives our programs touch. That's why I'm so proud to be with you today and share a new commitment to continue our track record of embracing disruptive change in healthcare. Working with the VA's innovation ecosystem, we are proud to partner with Dean Kamen and his revolutionary iBot to deliver more mobility, more opportunity, and more quality of life for people who so desperately need it. Dean can talk about the science in ways I cannot. As you hear from one of America's great minds, I want you to remember this is so much more than a science project. You are now part of a revolutionary change in the real lives of our citizens. No one in America has done more work to empower revolutionary change in healthcare than Dean. I know you will find it a great treat to hear from him, and it's my privilege to introduce you to Dean Kamen. Dean?
Great to be here. And Chris, I am in an iBot. I don't know if you can see, but I'm walking up the stairs, getting on stage to where I hope people that have not seen an iBot will see it do something very important. It'll let me stand up, get to about 6 feet tall, 5 inches than I have in real life. And I hope that the whole VA community can recognize how important standing up, looking somebody in the eye really is. Over the years, we've been able to deliver iBots to a number of disabled veterans. This is the newest generation. We launched it with an FDA approval late last year. And the first half dozen we delivered to veterans, including a number of Medal of Honor recipients. Just a couple of weeks ago, Greg Gatson, 82nd Airborne, left both of his legs in the Middle East, left Manchester with our newest iBot. And you could see in his face what the value of independence and access the iBot can deliver. I want to make a statement here that I don't know protocols for an institution like the VA. I'm alone, I can take this off. It turns out, in a very fortuitous way, the COVID situation created a unique opportunity. My day job of developing products does not normally include bringing PPEs into the United States, but when the VA started having trouble doing that, I leveraged some of our connections, started bringing in PPEs. In the process now, we've delivered over 1,000 tons of them. But in that process, I got to meet some really neat, very passionate people at the VA, including Deborah Scheer, who's in this room today, and started talking to her about making more iBots available to more veterans. Turns out that we're very good with my 800 engineers at developing technology, but our company doesn't have sales, marketing, and distribution. We normally give that to our big partners. But when you're dealing with something like an iBot, which fortunately there's such a small market for, the big guys aren't that interested. And as I explained all of that to Deborah, she said there ought to be a way that we could partner directly with the VA to make these available. After I was introduced through her to so many neat people here, we decided my little company, is going to donate the next 50 of these devices into a program that, with partnership and support of the VA, we're hoping they will be spread around the country so that veterans that might otherwise not even be aware of this capability will be able to see it, try it, understand it, and for those for whom it's appropriate, we'll find ways to get them iBots. So I'm really excited to say that. This is the first time we've said it publicly. We've met a bunch of people here at this event, and we are just so excited that there are so many very, very senior people inside this organization that are all about innovation and all about delivering real solutions, real disruptive solutions to veterans. It's wonderful for me to see it. It renews my confidence in government, in America, and I'm happy to be here. In my understanding, Chris, unless you have some terrible question to embarrass me with, we're supposed to have a fireside chat with Dr. Kaiser, so I'll shut up and let you guys take over.
That was it from my side.
I'm inspired to take a look at this. Dean, that is just incredible. And Dean has brought this in and given us an opportunity to see how incredible it is to work with these people. Well, now we're going to have a chance, after seeing you demo your technology there, and thank you so much for what you've given to our veterans. That is such a great tribute to your work and the innovation that you have. We're going to have a sit-down discussion with Dr. Ken Kaiser. As you know, he was the former Undersecretary of Health for the VA. He's been the Chief Transformation Officer for Atlas since 2019, and I'd like to give a shout out to the Atlas team that's been supporting Dr. Vega here during this presentation. They've done an amazing job, so to that entire team, well done. But Ken Kaiser is no newbie to innovation and transformation, as he ran one of the biggest healthcare systems in the world, brought that innovation into the VA, and today is going to be able to share some of those thoughts with Dean in a fireside chat. So Dean, Ken, over to you all.
Thank you, Joe. And we're appropriately socially distanced, so I'm going to take my mask off.
And since you're sitting down, I'll sit down.
All right, hell of a deal. Way to begin here. So, good. I'm Ken Kaiser, Dean Kamen. We're going to take a little time this afternoon and talk about innovation and how you can operationalize innovation, or hopefully we'll get to that point. But I want to first turn to a conversation we were having earlier about what is innovation all about, and in what spaces is it particularly hard to bring about. So maybe you could share a few thoughts about how should we think about innovation?
So I think the first thing we should do is destroy two myths that the public associates with innovation. One of them is it's all about invention. It's about creating something. It's a gizmo. It's technology. That's not true. I'll explain that in a minute. The second myth about innovation is, it's always about success, eureka. And I think, to me, innovation is mostly about failure and more failure and more failure until you finally create something that's never been done before by finding all the ways it couldn't have been done before. Back to the first part, I think, again, a lot of people think innovation, let those technical guys do it. I'll run my day job. I'll do my business. You can invent something, but it's a science fair project unless it gets properly promoted on a large scale to enough people that it becomes part of the way we live and work and play. And since organized societies are always very reluctant to change, organized societies have a lot of inertia. Organized societies have a lot of people that love the status quo, that are afraid of risk and change, that once the thing, the invention, might actually exist, getting it to become an accepted transition to a new world in innovation is really, really hard.
So where is it hardest to innovate? What sectors do you find are the most difficult?
I'm glad you bring that up, because as hard as innovation is in any field, consumer products, people innovate, the new game, the hula hoop was. The problem with innovation, as I said, which is that it's always accompanied by failure, says, okay, what if you want to innovate in a space where failure is simply not an option? And I can only think of three places like that. The military. We can't afford a failure. We'd lose our country. In healthcare, we all love innovation, but I'm sure if you were going into the hospital tomorrow for a routine procedure, the last thing you'd want to hear from some doc is, I got a great new idea. And the third place where innovation is really a tough sell is in government, because you got a massive public commitment. People need stability in their lives, and governments, medical institutions, and the military are places where tolerating real substantial risk and failure is a very, very, very real issue.
Having been a real doctor once upon a time and talking to real patients, I can assure you they don't want to hear that, well, we were innovating with something and it didn't work, and sorry, it just doesn't fly. So let's move the conversation to talk about innovation in healthcare. And hopefully we'll come around to innovation in government healthcare, which are two of the areas where it's the most difficult to innovate. So just with a little bit of a preface here, I think you'd probably agree that healthcare is different than consumer products or IT or many other areas where innovation happens. It's more complex. There's, as we've discussed, less tolerance for errors. There's a usually very indirect connection between the payer and the patient and the provider of services. You know, it's a more roundabout connection, which also kind of affects how things get picked up. And having been in this space for longer than I'd like to think now, but we've been talking about disruptive innovation in healthcare for at least the last 20 plus years as really the solution to the disproportionately rising healthcare costs, the unsatisfying outcomes that too often we see in healthcare, the unsatisfying patient experience. I mean, we could go down the list, and people say, well, we just need innovation. And the market has responded. And one could argue that there is perhaps an overabundance of innovation in healthcare today, but it hasn't produced the dramatic and transformative change that we would like to see, nor has it really bent the cost curve. And indeed, in many cases, innovations had made the costs go up more because they've increased utilization. So why is that? What are your thoughts about what do we need to do differently in healthcare innovation?
Well, some of what I think we need in healthcare innovation is not what I can do. I know it's necessary, but it's not my field of expertise, which is policy changes. We've already mentioned now, both of us, a couple of times, that one of the reasons real innovation, particularly in healthcare, is hard is because since innovation is associated with risk and failure, there's an extra burden to be extra careful when you're introducing innovation in healthcare. And I'm sympathetic to the particularly cautious situations that you have to deal with when you're innovating. You know, an iBot would be a really bad device if it would fall down with a disabled person in it. So you have to build very, very, very robust systems. One of the places where I'm not that sympathetic to why innovation isn't as commonplace and moving as quickly in healthcare as in other industries is because policies. There are a lot of perverse incentives that still exist in the healthcare system. A doctor can't be paid for not having to do a procedure that a patient didn't need because we used preventative care in the first place. A hospital is going to have trouble staying open and paying its bills if its beds aren't full of patients that were brought in to do the next procedure. Basically, our entire healthcare system isn't a healthcare system, it's a sick care system, and almost all of the money going into it is to cover the cost of chronic treatments. Very little of what we spend in this country in healthcare is in preventative care. Very little is available in curative care. All of the big entities are very, very well aware that the large, long-term economic future is in creating a treatment for something that sadly will stay with many patients for a lifetime. I think we need to find ways to fully incentivize the innovations that will prevent the disease from occurring in the first place, or once you have a condition, finding a way to cure it, not treat it on a chronic basis. But just look at the percentage of money that is spent in prevention, cure, or maintenance in chronic conditions. And I'll give you two examples of two government agencies that deal with that. One is healthcare, the FDA, and the other is aviation, for instance, the FAA. The FAA is there to make sure every plane that takes off lands without an incident. And all the money goes into preventative care. You take airplanes apart relatively frequently, annually. You put multiple engines on an airplane, so even if one fails, the other one will keep you going. It's expensive, but it's a lot better than, oh, the engine failed, the plane crashed, and now we're going to pick up the pieces of 300 people. When you look at the percentage of money that gets spent preventing a problem from ever happening in aviation, for instance, how the FAA looks at what they do versus, let's say, our healthcare system, I would only tell you that we take way better care of our airplanes than we take care of our people. And it shows.
You raise a number of things there that I'd like to come back to. And payment is certainly one of them. And an example that comes to mind, we've talked in other sessions today about the COVID pandemic and all the effects that's had on the healthcare system and system in large. But let's talk about telehealth. Telehealth as an innovation. In 1999 or 98, I hired the first healthcare system telehealth officer, certainly in the United States, if not the world. And VA did a number of things over the years that increased its use of telehealth, but it really didn't become a mainstay of treatment, even though it didn't have some of the payment barriers that exist in the private sector. But along comes COVID, and within a matter of 2 or 3 weeks, we see this dramatic increase in telehealth, not just in the VA, but elsewhere as well. Now, a lot of that was driven in the private sector by changes in payment policies. But it shows that when we want to innovate, and when the right forces are at play, it can happen. And we saw more progress in literally 2 months than in almost 20 years previous. Thoughts on that?
So my thoughts on that are, again, pretty straightforward. People will tell you, companies will tell you, governments will tell you, they're always willing to invest in a better future. They're willing to invest in innovation. But deep down, innovation, again, it's risk, it's uncertain, it's change. And most people learn to be very risk averse over their lifetime, and that's not a bad thing. But what I have found over my lifetime is people are way more willing to accept change if they're running away from something they're afraid of. Fear is a much better motivator for change than opportunity. And the fears around dealing with COVID in a one-on-one basis in person, I think that the fear drove people to adopt something that was already there, could already be delivered, but the status quo and the inertia and the risk aversion of our culture, of our government, of our companies, was making the adoption of telehealth very slow. Then introduce that fear factor, and suddenly we've accelerated the ability to weigh the risks and benefit of change, and we saw essentially a disruptive change. The good news is you generally don't unring the bell. Once people see that step into the unknown and they land on a place they like and they light it up and now it's known, they don't want to go back. So I think one of the benefits of having come through the trauma, or hopefully coming through the trauma of COVID, is we're going to see enormous changes in the ability of the clinical community to interact with patients all over the country more effectively, more efficiently. Patients that were in remote places that really couldn't access in person, even when there wasn't a COVID situation, are going to be beneficiaries as well. We are going to move the healthcare system in the same way we've moved every other big industry in this country and in this world to a more efficient place by adopting the technologies of the cloud.
You know, in some ways, it's such a no-brainer. You know, if you're a senior with a few medical conditions and you need to go in for a checkup, you can either get in your car, battle traffic, find a parking spot, go to the waiting room, wait for a while, and then get seen. Or you can punch in a phone number and sit in your easy chair at home and get seen. I mean, it seems like that's not a hard decision. I think a lot of people have actually figured that out, and I agree that we're going to see a lot of this virtual care stick going forward, although we have to kind of find the right balance. But you raised this point, you know, there's a lot of things that drive innovation, and we'll come back to some of the other things, but let's just stay on the payment vein for a moment, because, you know, payment is an issue. One of the other companies, and I don't know if it's been talked about or not, but one of the participants in the innovation ecosystem has to do with preventing diabetic foot ulcers. And it has shown Podometrics, a company, I think it's okay to say it, hopefully it's okay to name it, but it's one of the stars, if you will, of the innovation ecosystem. Dramatic results as far as preventing amputations, preventing hospitalizations, preventing emergency room visits, preventing outpatient care visits. But the issue is how do we get payers to embrace this new technology, which really is a quantum step forward in how to treat this very common, very costly, very devastating condition?
Again, I think it's an innovation is required here, but it's not an innovation of physics and engineering and the stuff I and my 800 people do. It's got to be an innovation in policy. And I think we all talk about it, and they keep talking about over the last few administrations, healthcare reform. And then you look at all the bills they talk about. It's not healthcare that they're reforming, it's health payment they talk about. Healthcare reform would be moving towards doing better technology to prevent the disease in the first place or to cure it when it happens. We're building an organization now to manufacture replacement human organs. That will change healthcare. But all the changes that they're talking about don't deal with a fundamental issue, which you sort of got to when you said payment, which is a market economy only works when somebody's paying for something after they determine what value it has and what the alternatives look like. Our healthcare system, for various reasons, whether it's government or insurance companies or employers, has created a situation where the patient, the one that gets the product or service, is not the customer. We are the recipient. And when you're the recipient of something that you're not directly paying for, you're not the customer evaluating the alternatives. We have a healthcare system in which the average citizen has only two modes. I'm feeling healthy now. Whatever healthcare costs, I don't want to buy any of it. I don't want to pay for it, whether it's my insurance premium. I don't want it. And once I'm sick, I have a slightly different attitude. I want everything you can possibly give me, and I don't care what it costs. Neither of those statements is amenable to a market economy. So we either have to create a way to bring the market economy back to healthcare innovation and all the players and stakeholders in it, or we have to come up with a different system to incentivize the right kind of behavior, because right now, I'll come back to, we have the most perverse incentives you can possibly imagine for the people that pay for, people who deliver, and people who receive healthcare.
I have that conversation about why you need health insurance with my older daughter frequently, who's healthy, vigorous, single. It's like, you know, why do I have to keep paying this premium? You know, because it's not cheap. And anyway, let's shift a little bit and talk about scale. You know, one of the issues, and it could apply to the example that we just talked about, but how do we actually, at this point, that's an innovation that works. There's published literature in the refereed, peer-reviewed literature. We know it works. How do we now get it out and take it to scale so that it now becomes the norm in treatment as opposed to where we are right now?
Again, I would say one of the innovations that we desperately need, and I think the Veterans Administration could lead this charge, is to say, let's look at the overall cost of dealing with whatever this clinical condition is, whether it's chronic or episodic, and let's look at the entire cost of the alternative ways to deal with it. And once you look at the patient and look at the best way to give the patient the best outcome and look at all the different places you can participate in creating the solution, pick the best one, pick the best value. Right now, we don't do that. As an example, an iBot may in itself cost more than a wheelchair. But if an iBot eliminates the need to have lifts and special vans, if an iBot eliminates the need to modify your house with ramps, if an iBot eliminates the need to move out of your house, to move to assisted living because you can't get in and out of your house or your bedroom or your bathroom, and you looked at it and said, wow, if a veteran had an iBot, the overall cost to the VA would be way lower. The outcome and the quality of life for the veteran would be much higher. But if you have a system that says, we go and we buy the most cost-effective solution to this particular aspect of a problem, and we parse that into all the different silos in our healthcare system, you end up spending a lot of money on a lot of different things and end up with a very, very low overall quality outcome. I think our healthcare system, if it were driven by efficiency, effectiveness, quality of life, patient outcomes, if it were incentivized properly, we would spend less money and we would get better outcomes across almost every set of conditions you could imagine.
That brings to mind a specific example of something I dealt with well over 20 years ago when I was at the VA. And it's this whole issue that preventive measures typically don't pay off until some years down the road. And there's a specific reason why I want to dwell on this for a moment that I'll ask you about. And so whenever it was, in the latter mid 90s, the statins, a group of drugs that lower cholesterol, came on the market. And many of the managed care plans weren't adopting them, weren't putting them on their formulary, their preferred drugs. For me, it was about a 20-second decision that, yeah, of course it's going to. But one of the big differences was that VA has its patients for a long time. So you see the benefit over years, which may not manifest. Whereas if you're in a typical managed care plan that turns over every 2 or 3 years, you pay for something that was at that time a relatively expensive drug, but you don't see the benefit. Somebody else is going to see the benefit years later. So with that as kind of the preface, this, what I want to ask you about is how do we invest in innovation in government in particular? Because many of the things that the innovation ecosystem is doing right now is not going to have a payoff for many years down the road. In some cases, it won't be that many, but you know, it's not going to be next month or 6 months, and you have more patients than you can take care of, and that's costing. How do you make that balance between, I'm going to invest in let's just say the innovation ecosystem, but if you're another healthcare system, it might have a different name, but you know, same idea, but the payoff isn't going to be down the road. How do I have that conversation with the CFO that says, you really got to invest in this program?
So once again, I'm not here to pander to the Veterans Administration, but even at a dinner we had last night with the guy that's running this innovation program, Ryan, it was so refreshing to see senior people, doctors, that get that issue. That part of me said, you know, I was just this fortuitous way I ended up having the opportunity to participate, reminded me, again, I'm not an economist, but I would tell you,
and I'm glad of that, by the way.
Well, but I mean, economists come up with all sorts of solutions. I mean, there are people that think business and capitalism will solve all our problems. Look at our political situation now. And there are people that think capitalism is awful and it will solve none of our problems and you know, big bad industry. I think they're both completely naive and wrong. I think there are categories of human behavior that are properly incentivized by the competition of business, and an economy that has a strong capitalistic, you know, aspect is great. But then you look at educating kids takes a generation. No business wants to invest over that. That's why we have good public education, and it's critical to our future. No individual company wants to build tunnels and bridges that will last for 50 or 100 years. There are investments that you make, critical investments in infrastructure, in education, healthcare, that I think as an organized society can't be justified by the ever-shortening cycle that Wall Street and business has in product development, but it's critical to our society. And it's those things that I think government needs to step up and say, we're going to invest in basic research, the NIH and the, and the National Science Foundation and public education. And again, not to pander to the VA, but you have this enormous group of patients that, as you point out, you have for a much longer period of time than anybody else. You have all the leverage of scale, of size, of government, the number of patients that you have, and the fact that they deserve so much more than anybody could ever claim some other citizen deserves, because in many cases, they literally, for instance, gave their legs or their arms for this country. So I think the VA is the perfect institution to take leadership and say, we're going to demonstrate that over the long run, maybe a lifetime, innovations that can prevent something from happening in the first place, that will give somebody a much better quality of life than they'd ever have, even if we could afford to treat them chronically. We're going to demonstrate that long-term, lifelong perhaps, commitments to innovation are not only going to give people the best quality of life, but they will bend that cost curve. I mean, look, I've done very well in business making dialysis machines. I'm making them now, hopefully that the VA is going to put in people's homes to make their quality of life much better than having to send them off to these centers. But as much as I'm proud of making that kind of product, that's a $100 billion a year problem in this country, is taking care of people with end-stage renal failure. And I can tell you, as good as our equipment is, nobody ever said to me, I can't wait till I have end-stage renal failure and get to use your new machine. If those patients that know they're going to lose their kidney function soon could show up at a hospital and have somebody give them a replacement kidney, a cure, not a treatment, those patients will have a much better quality of life. And oh, by the way, it's much cheaper to give somebody a kidney transplant than it is to give them dialysis for the rest of their life. And that's true of just about every other condition. The only thing better than giving them a one-time cure instead of chronic treatment, the only thing better than that is prevent it in the first place. And, you know, vaccines, one vaccine against polio instead of spending your lifetime in an iron lung. Which would you rather do? I mean, Einstein himself, Einstein said, smart people solve problems. Geniuses prevent them. I think our healthcare system should be focusing a lot of its innovation on prevention. And institutionally, I think the VA could take that leadership. It has the resources. It has the right incentives to do it, because you're going to take care of these people. You want to give them the best quality of life. You want to lower the cost. Take the leadership.
So this raises a question which I originally wasn't thinking of asking you, but you've set the stage here. So VA doesn't have a board of directors in the traditional sense.
Neither do I. That's why I can do this. Okay.
VA's board of directors are the 535, 38, whatever members of Congress who oversee what they do, and who are, you know, have lots of budgets to balance. And as you said at the outset, government is one of those areas that is risk averse and has very low tolerance for failure. So how do we have the conversation with our board of directors about, one, the importance of investing in innovation, and two, if we do that, there's going to be a bunch of failures?
I think there's two parts of that. One is, how do you have the right conversation with those 535 members of your board? The other part of the conversation is making sure your board of directors is composed of the right, open-minded, smart people that are capable of weighing the risks and benefits. And for that to happen, the conversation you need to have is with the 300 or 400 million people in America who elect that board of directors that you have. And I think the American public needs to understand what the risks are, what the benefits are, and they need to be willing to invest in the long term in solutions to problems that we as a society need to have. They need to make it clear to their elected officials, your board of directors, what they're looking for. And again, that general public and that board have to be willing to tolerate reasonable risk. They have to be able to accept some amount of failure. And if they can't do either of those two things, we will be left marginally limping along as the costs go ever higher, as the quality gets ever lower, and frankly, as we see the rest of the world surpass us in terms of capability to deliver better technologies, give people a better quality of life and lower cost, and then turn out to become the suppliers of products and services in our country, which again is going to be really bad for our economy.
So much of the innovation, certainly in consumer products today, is about instant gratification. And indeed, Americans as a society are kind of known around the world as for their impatience and their desire for instant gratification. So how do we have that conversation? How do we have it with the public? How do we have it with the Congress that these are long-term investments and you have to make it? It's like investing in bridges and tunnels. You're talking about decades into the future.
Again, I think both parties are to blame for trying to give everybody a simple, easy solution to what is, in fact, a very difficult, expensive problem. And shame on both of them. The American public should be smart enough that they should hear somebody say, we're going to give you the best health care, and it's free, or it's the lowest. Well, I'll give you one or I'll give you the other, but I can't give you both. In fact, I know of nothing in human experience that's really, really valuable that's not worth paying for. I just don't know of any such thing, and I can't think of anything that's more valuable to most people than their health, or at least the health of their children or the health of their parents. We should stop explaining to the American public, because we want to buy their favor or get their vote, that you can either have all of it and it's free, or I mean, we have to start being realistic and say to people, you've got to invest, you've got to make long-term investments in technologies and processes that in the end will be better for all of us, better for our country, better for your family, better for your children. But it's not going to be free, and it's not going to have no risk. Get over it.
So among those entities that need to be invested in, one you didn't mention, and I want to bring the conversation around to it, and Dr. Vega and I recently wrote a paper about the infrastructure that an organization, health systems need to operationalize innovation. And at the top of that list is workforce and investing in your people. Now, since that paper came out, a very prominent individual in healthcare said, you know, I tried to do that at another government agency about 10 years ago and got completely trashed by the Office of Management and Budget. And I've heard others say, well, I tried to get that by the CFO, but, you know, they just got to spend on this, and you know, I don't see what the return on investment is in the workforce. What do you say to these people?
Again, maybe I'm being cynical here, but I think accountants and people that look at business for the ever shorter cycle to make the smallest investment to get the biggest return the most quickly and move on. I mean, sometimes I think accountants and economists are people that have figured out the cost of everything and the value of nothing. And I don't think we should let major policy decisions be driven by people with the very short attention span that we see, even in a lot of these elected officials that seem to be chronically running for the next spot. I think, again, given the opportunity to really understand the issues, the American public will rise to the occasion of being willing to pay reasonable cost in terms of time and effort and risk to develop the next generation of medical solutions to our problems so that their kids will have a better life. And frankly, we won't let healthcare costs running the way they are now just bankrupt the country. I think there's almost good news, as I said in the beginning. People are more likely to accept change based on fear than opportunity. The opportunity of better medicine hasn't moved a lot of the people, the entrenched people that have a vested interest in status quo. But the fact that this country is going to bankrupt itself unless we change might be the right stimulus to have people start being willing to take appropriate risk, to move forward, to give up some of the processes and procedures of the past that have perverse incentives and move to a better system. And again, something as holistic as the VA could be the poster child for making that happen.
This is this focus on value, I think, is such an important conversation and a concept, and it's another one of these ones that we've been having in healthcare about value-based care. We know lots about cost of care, And literally for at least 2 decades now, we've been trying to push the value-based care to think about total cost of care, what's the value to all the parties. And actually, this may be one of the silver linings in the COVID pandemic, because I think what we've seen is the biggest impact from an economic perspective are those who have been holding on to the fee-for-service system. And those who have already in value-based care, managed care of different types, are actually doing okay, if not well. And this may be, or the pandemic may turn out actually to be a stimulus in catalyzing and moving value-based care forward. How should we think about value when it comes to innovation?
So again, I think in the medical space in particular, the extra burden that innovation is inseparable from, at least early on, failures and risks and surprises which don't put a smile on your face will make really, really disruptive innovation in healthcare always harder to do than in consumer products. And the mere fact that in some cases clinical trials take years to do, there are so many potential unintended consequences of a drug or a procedure that need to be fully vetted and fully understood before there is massive acceptance, makes that stuff take a long time. And I think one of the things that maybe government policy needs to fix and change is you get a smart young kid out of college who wants to be really innovative using some great new technology, AI, machine learning, whatever. And that young person can either go into a field making video games or consumer products, or can take this new technology and possibly create the next great new disruptive improvement in healthcare. But the video game could turn into a business and turn into a lot of money in 6 months or a year.
Right away.
And this person says, I'm going to spend the next 5 or 10 years working on this really difficult problem that has human health at the core of it. But what do we have to do to incentivize smart people to be willing to invest their time and their effort in the long-term important problems that need to be solved when they have so many short-term easy alternatives? And which is why I think you see, I mean, every 6 months there's a whole new generation of this kind of thing. You don't see every 6 months a whole new generation of just about any medical product. In fact, if you walk through a hospital today, most of the equipment that's there, you would be very familiar with, even if you haven't practiced medicine in 20 or 30 years. We have to find ways to appropriately incentivize individuals, companies, and the government to take bigger risks, understanding that unless the reward is commensurate with the risk, people are not going to make those investments.
I want to shift the conversation a little bit here. You mentioned in one of your previous comments about partners. And I think one of the hallmarks and one of the very distinguishing aspects of the VA's innovation ecosystem is the broad array of partners it has. From the private sector, there's some other government agency partners, there's nonprofit partners, but there's a real panoply of partners. What should, and by the way, just also in the way of preface, I've worked with quite a number of startup companies over the years, and one of the things that they invariably say is, it's so hard to work with government. And they say it's even harder to work with VA sometimes. But, you know, what would you tell government people, VA people, about how to have successful partnerships, or how to attract and retain partners, since I think we would agree that they're essential and they're an essential part of the prescription for advancing innovation?
I think part of the answer to the problem is the way you stated the question. You said, how do we get them as partners to be better? I think the very first thing is to make sure that our government agencies see industry as partners, as potential partners, as real partners, and not across the table as somebody with whom you're negotiating. You know, the example I've used in the past, and I have to be careful because we want the love and affection and support of our friends at the FDA, but we understand their job is to protect the public in one sense, so they should be across the table. On the other hand, I say, well, there are government agencies out there whose primary goal is to protect the public, and I use as the example the building department. If you went into the town you live in and said, I'd like to make a big investment, I'd like to buy some land, and I'd like to build a retirement home or a school or a business that'll pay taxes, they have a building department. On the one hand, they have to make sure you meet all the codes, you build high quality, there's the fire issues, and the public wants to make sure there's a government agency that is protecting people from maybe people that would otherwise cut corners. While that may be true, if you showed up at the building department, they'd welcome you in, and you'd show them your plans, and they'd say, that looks great. No, you can't do this. No, you need a SEPA. No, we need this. You need more rails. They want you to succeed. They need you to succeed. They're there to serve their community, but they, in the end, have to also, after you tell them what you're going to build, they reserve the right, in fact, they're required to come in when you're all done, inspect it, and if they don't think you met their standards, they don't give you a certificate of occupancy, and you can't move in. So up front, they have the right to review what you're doing and approve it, and at the end, they have the right to make sure you did it, but they're working with you the whole time. When you go to a government agency to invest way more than it would cost to build a house, and it'll take way more years to do it, they don't say, we want to work with you. They think their job is to be on the other side of the table. That's changing, the good news. And when you're all done and you deliver it, you want to know you're going to get a quick response. They're going to review the situation, give you your certificate of occupancy. I think over the years, because bad actors have done bad things and regulations are always written to protect the public from the bad actor, but as that pile of regulations gets bigger and bigger and bigger, like what they did to business people when they passed rules after the financial crisis. I'm told that a lot of small businesses simply couldn't even go forward or do what they need to do because of the onerous new regulations on businesses that were put in place because bad actors nearly destroyed our financial systems. I think bad actors in the medical space that caused horrific human disasters have caused us to create a regulatory environment that doesn't necessarily make it easy for the regulators and the well-meaning, honest, smart developers to really work together. I think when we show up at a government agency with a new idea, it may not be right, we need to check it, but I think the government side and the industry side should say, we were working together. My job is to create a good potential solution, and your job is to figure out how to make it as quickly and safely available to the public as you can. And that attitude, and the good news is I think the pressure is changing, but I think the long answer to your question is government agencies are full of the same kind of citizens that the business side have. They have slightly different roles, but they should keep reminding each other we're working together. We're trying collectively to make the public a place where better solutions, lower cost solutions, more effective solutions are being developed and delivered as quickly as possible. And until they have the respect and trust for each other, that's their partners in that mission, there's a lot of frustration, a lot of wasted time, and a lot of wasted money, and we've got to get past that.
Are there, in your mind and your experience over the years, are there 2 or 3 things that a government agency like the VA, which is not so much a regulator like FDA, but is in the service delivery side, are there 2 or 3 key things that they could do to build trust, to build confidence, as really the foundation for those partnerships?
Again, I'll give as an example this. I was lucky enough to meet, as I said, some people, including Deborah Scheer and said, look, I so strongly believe that if an iBot were available to a vet, it instantly improves their quality of life. It's not like a 5-year study and you have to look at what the effects of the drugs are. It's pretty instant. You get in this thing, you stand up. Most of these guys get emotional. But I said, I also believe that in the long run, it's going to be cheaper than any other alternatives that are available to somebody who no longer can have a job or live in their home or needs antidepressive drugs because of this. And I said, I am so confident that overall, over any reasonable period of time, you're not only going to give people better outcomes, but overall lower costs. And we'll just put 50 of them out there and we'll measure the result. Unless an agency is willing to look at a new technology and understand what it might bring, it's too easy for them to check the box. Oh, can't walk, needs wheelchair. Wheelchair cost says, oh, iBot's cost. We don't have iBot. It's easy to say no. It's easy to say we never did that before. We always do it this way. You need people on both sides of that relationship to be willing to look at an opportunity, understand that there's things we're not sure about, but move forward, collect objective, real data, and determine what to do next. Until I met some of the most senior people that I've met here, I was pretty much told, you're going to be seen as selling a very expensive wheelchair. Their budget for wheelchairs will not include iBots. And I kept saying, an iBot is not a wheelchair. And I now believe that we have the attention of people that are going to look at this holistically. And by the way, if it turns out these things aren't reliable or they don't work or they don't reduce these other costs or they don't improve the quality of life, you shouldn't buy any of them. This should be considered a failure to meet the right need with the right technology. The flip side of that is, if this is a solution that improves quality of life and reduce costs, it should be embraced and accelerated because it's a win across all dimensions. But in order to make that happen, you need people inside an agency of this scale that are nimble and flexible and ready to seize opportunities to move forward. And finding a really large agency that can get past a lot of its own bureaucracy to seize opportunities has, I think, historically been a difficult thing to do.
And I'm mindful that the clock is soon going to run out on us, but I'd like to just come back to that aspect. And you mentioned, the person has to recognize that or be willing to do something different. And by the way, every time I've ever done a change on my house, the building inspector wasn't very willing to bend anything. But how do we, or do you have any thoughts on how you encourage that type of culture change or the mindset within government agencies of, yeah, let's look at that. Let's look at it differently. Maybe there's a new way of doing it that isn't in the rule book.
Well, in part, as we talked before, you talked about your 535 members of your board that dictate how your company is run. I think if you were working in a big government agency and never let anything bad happen and therefore never got hauled up to be skewered in some public event on the Hill, you could get through a life and a career and be happy. But again, overall, over time, that creates the perverse incentive for government employees to say, hey, if I take the risk and I make something happen and every once in a while there's an issue, I'm going to be penalized for the issue. But the upside went to the beneficiary, that patient, or it went to the company that made it. And if you work in a government agency where all the benefits of you taking that chance and moving ahead accrue to all sorts of other people in the system, but not to you, and it's not a merit-based system. Whereas if something ever goes wrong, they're going to look for somebody to blame, and it's going to be you. You end up causing the culture of this big organization to become so risk-averse that innovation becomes harder and harder and harder to do. I think we have to make sure that we, the public, demand that the people on the Hill stop making grandstanding events to go after officials, at least, or make it so that they grandstand as many times about not allowing innovation, not taking reasonable chance. But the people in government, in jobs, in careers here need to know that they will essentially be rewarded or appropriately protected if they are innovative and take risks, or they will gradually become so risk averse that the risk-benefit decision-making in government will be very, very different than what the public needs and deserves, what businesses need, and it's a problem, and we should fix it.
Well, I was undersecretary at the VA for 5 years. I think that's the longest of anyone ever. But I did have the opportunity on more times than I would like to count of being hauled up to explain things, not all of which had gone right. So I have that drilled down pretty good. We're about out of time. What have we not talked about that you'd like to tell people? Any thoughts that you'd like to share in the last minute or two that we have here?
I would again just ask our government employees to remember that at least most, I'd like to think most people in business have exactly the same motivation and incentive as they do. We want to deliver better health care to more people more effectively, and the only way we're going to do it and get innovation is everybody's willing to look at all the issues, all the opportunities, appropriately weigh the risks, and move on. And unless all the players are harmonized on doing that together, there will be infighting and frustration and self-inflicted wounds that prevent innovation from becoming a part of the culture and a part of our whole healthcare system. And boy, does our healthcare system, on every dimension that you've talked about, need innovation and need it quickly.
I couldn't agree more. And it occurs to me that one of the things that I found helpful was often just communicating with our board and telling them up front that this may or may not work, or when it didn't work, be straightforward about it. But that's hard to do in government because they often aren't very tolerant of that sort of thing. So I think with that, we'll call it a wrap. I really appreciate your being here and taking the time and chance to have a conversation.
So we have a great video.
That's
Investment in the future of kids. Become the scientists and technologists that we need in every industry, but in particular medical. It's an organization called FIRST. I started it 30 some odd years ago to convince more kids, particularly women and minorities, that at an early age, just the way at an early age they embrace other sports, they want to eventually grow up and be good at football or basketball, they better in the end be good at thinking and problem solving. I use robots as a way to inspire kids to be excited. We have a little 2-minute video in which a 7-year-old girl points out the value of FIRST, and she points out over and over again, it's not about the robots, it's never been about the robots. It's about kids and self-respect and getting rid of poverty and getting to world peace and getting to communication and getting to cooperation through the appropriate recognition of science and technology and engineering. Listen to this 7-year-old girl.
Good. Let's watch.
This isn't a robot. It very well may have hydraulic arms, a drivetrain, and a circuit board, but this isn't a robot. This is a lesson in humility, hard work, and collaboration. This is a CrossFit workout for the muscle upstairs. This is an apple for the next generation of Newtons. It's a lot of things, but this isn't a robot. This is a roadmap that leads straight to engineering. This is a rock to shatter 1,000 glass ceilings, a rope to pull a generation up and out of poverty, a sledgehammer to break down cultural barriers, and a universal language spoken in every nation on Earth. And because of that, this is a compass that can help point the way to peace. But please, Don't think this is just a robot. This is Glastonbury for technology. This is mission control for the next moonshot. This is the Rosetta Stone to help translate the future. This is the sport that will help us win tomorrow. This is the software to program ourselves to cure cancer, build a clean engine, or step foot on Mars. But this isn't a robot. It's a machine to build the people who will change the world.